Mark, I'm going to turn to you because, you know, you have done so much on, you know, value-based care, effective drug and device innovation, and transition to values-based care. I would say it's been going okay, but a lot of people are feeling stressed and strained and trying to, you know, and there are also growing concerns that this payment reform may stifle innovation. Right? So the question that if you have those 3 minutes with the next president, what priorities would you highlight as critical in making progress with payment reform?
Well, I'd start by letting the president know that there is a lot of work done by the National Academy and others showing that these issues of having both affordable health care and health care that is innovative, able to take advantage of all the things that we're learning, as Larry talked about, to help improve and lengthen lives. The opportunities are better than ever, but we do need to change the health care system to do it. I have the benefit of Risa already making the argument for switching from volume to value-based care, but as you said, this has been difficult, so some steps to make it easier. One is providing better support to healthcare providers. There are some good ideas for reducing the provider burden through things like using common, well-validated measures of outcomes and what we're trying to achieve in these healthcare reforms. Second, there are regulatory reforms that are needed. A lot of the ways that we regulate healthcare are built around volume-based systems and not around encouraging healthcare providers and patients to work together and share information. Third, innovation is really important, and we need to keep in mind that some treatments are going to be worth it despite not saving money. They're going to be worth it because they help people live longer and better lives, not just because they, and not even mainly because they prevent complications. Finding ways to pay for those treatments in a value-based system could work. For example, in the next few years, we'll have a lot of genetically based treatments coming along if development processes go as scheduled. Paying for those instead of a very large amount of money up front, but rather through some scheduled payments over time that are tied to actually getting better results for patients. So sickle cell patients being able to stay out of crisis and stay out of the hospital could be a basis for a results-based payment system for a curative gene therapy. And finally, as others have emphasized, we need better evidence on what works through reforms in data sharing, through reforms in making available better measures of results. We can help identify which of these payment reforms and these new approaches to care delivery are really working better. And then I would also emphasize the role of patients or consumers in all of this. There's been a lot of attention paid to changing the way that providers get paid, and probably not as much on matching that with changes in the way that health insurance and coverage works for patients. We still have some very volume-based benefit designs, and there's some good ideas out there, including in the National Academy reports, on how to move to better value-based benefit designs for patients that go right along with this emphasis on supporting people and getting the best care at the lowest cost and helping them save more money at the same time.
Perfect. Mike?